one more thing I want to point out, we have the air water syringe tip that you can get from dispensary, and it's quite simple to use. You can just pry it out like that, rip it out. This goes on the attachment here, and there's a little coupling here, little ring that you can just depress a little bit, just like so, insert it, and then that locks into position. So, and there's two buttons here, one for air, one for water, and I'm going to use the air once you have your master turned on, and that produces a nice flow of air, which allows me to air dry the adhesive a little quicker. And you want to make sure that this stuff is relatively dry. Okay, so from here on, I'm going to take the impression gun, really lock it into position, feed it forward, remove the cap, and I'm going to get the thicker of the two, which is the blue one versus the yellow one, syringe tip. And this is a bit of a spiral effect. I think we've probably talked about it in class by now, or if we haven't, we will. And I want to make sure, and what we're going to do, we're going to apply some material now and insert it back in the patient's mouth, and we're going to do this border molding technique all at once. Now, this takes a little more experience to do, but hopefully as you're working your way through George Brown, you'll be able to do it before you graduate. So it's a good idea to know both techniques. Before I start, I want to make sure that I have my Fawn stock here so I can smear the material around a little bit. I want to make sure that my patient is ready to go. The lighting is in the proper position, so I'm just going to turn that off right there. The chair is in the right height because I want to minimize any waste of time. So because I only have a certain amount of material, certain amount of time to work with this stuff. So I want to make sure everything is handy. The other thing that's missing is my mouth mirror. So I'm just going to set it right there so everything is good to go. All right, so once you start, you got to keep going. So introduce the material, generous amount here. And right there. Set that on the side. I'm going to take my Fawn stock and just kind of smear it all around a little bit. So we have the material kind of initiating over the tray. And I think we're good to go. So I'm going to grab it here. Be careful not to displace anything. Robert, head back for me. The light is on. Make sure everything is nice and tidy. Get you to relax your lips for me. Raise your tongue up a little bit. And gently rotate it. Good. You okay with that, Robert? Okay. Just a bit of a squishing sound in there as the material settles down. Now, gently, I want you to bring your tongue out to me, Robert. Gently. As I'm holding it in steady. Move your tongue left and right. And relax your tongue now. I'm going to take my fingers, put it right on top of the rest. Close for me a little bit. Good. And relax there. And relax there too. So it's very important that we have it in the same steady position all the time. A little bit of material here. I'm just going to smear that off. And this is not the final impression. This is just the initial layer so we can put a final coat of impression material right on top of it, providing it comes out well. All right, so this material takes about 30 to 40 seconds to get hard, which is right about now. I'm going to push it back just a little bit because we've engaged that undercut in the retromylohyoid area, and it comes out something like this. Now, before we look at it, I'm going to clean up my patient here a little bit. I'm going to have a little rinse. Thank you. And this turned out pretty good.
That wasn't too bad.
That wasn't too bad.
No, I mean the taste.
The taste, it's almost
It don't taste like
tasteless.
that inner crab.
No.
Why don't they make the first one like that? What's wrong with these companies?
So this looks pretty good. We got a nice capture of the buccal shelf here. So you can see there's some folds and creases here, which are not a big problem here. A bit of a high spot right here, which I'm going to cut back and trim off before the final impression. But there are a couple of short areas here, the retromylohyoid area, which not a problem. I'm just gonna go back and reintroduce a little bit of material and do that again. And that little spot there and this little spot here to make sure we have full extension here, because this is where really the undercut here is, and I think this is what's going to help our patient create a lot of stability and retention with a lower denture. Okay, so once again, when you're applying new material on top of the existing, you don't have to use adhesive because the material bonds to itself or adheres to itself. So only when you're introducing it to custom tray material. So I'm just going to start on this side again, and once again I'm going to remove this tip. This tip now is done because the material is set inside. And I'm going to inject a little bit on my hand here just to bleed the cartridge a little bit and introduce a little more right here. And I'm going to do one side at a time. If you try to do both sides at a time, what's going to happen? You're going to smear one side going in and really defeats the whole purpose. So I have a little more working time now because I don't have the whole tray to work with. I have just one small little area, and I think I'm going to introduce a little bit here too. Okay, so remember, the side that I'm introducing the material is the side I'm going to tug. Relax for me, rotate it in, just a bit of a stretch. Lift your tongue up for me. And gently place it in. Open for me a little bit, Robert. Going to push the material down there. And I'm going to ask Robert now to move your tongue to your left side and back to the right. And back to the left, and gently bring it out towards me a little bit. Good, and relax your tongue for me. Is anything hurting you there, Robert? Okay. So hopefully that'll turn out nice, and then we'll be able to finish off the other side. And be able to take our final impression. So this little ledge here that I created that kind of joins the finger rest and the tray handle that we'd normally do, it's kind of nice because I can really rest my fingers anywhere I want here to create a nice stable position and consistent position. So now, because I've engaged the undercut, I'm going to pull it back a little bit, unrotate it out from the patient's mouth, otherwise it becomes rather uncomfortable. There you go.